Fraser Health has an ambitious agenda to reform and improve how we care for this incredibly rapidly growing communities across Fraser Health. Concurrently, the economic situation has brought forward the sustainability issues that are probably foremost in all of our minds at the moment, and has been for some time. Fraser Health believes that it's time for reform, and we are doing that. Simply tinkering on the edges of what is custom and practice for decades of healthcare provision just won't be good enough. We need to do things completely differently. So the really good thing is the province has sustained healthcare funding to record levels. Health authorities will in the next 3 years receive a 20% increase in funding. That's very good, especially in the face of a recession. But we are also facing unprecedented demand for services. Our aging population, our growing population, growing expectations about what people want from their healthcare system as opposed to what we need and can afford to deliver. There is a tension and it's growing and we need to deal with it. There's a great saying I heard recently, and you hear all this talk about recessionary pressures, and that is, why waste a good recession to really push change? And we need change. While the majority of the challenge we are facing will be addressed by raising revenue, reducing administrative and support costs, and re-engineering the way we work within the system, some of the challenge will need to be addressed by reducing some of our service areas back to what we need to do in our core. And we have been doing this. You'd only have to open your newspaper to find issues that we are facing regularly with our communities. To have that robust debate, it's an important debate as we decide what we should be providing. In fact, I've spoken to a number of mayors who said, well, thank you very much, Nigel, you're doing a wonderful job for us because you're keeping us off the front page of the newspaper. So that's an interesting way of assessing my performance. Our success is totally reliant on our appetite for innovation. So I make no apologies for this health authority doing things differently, challenging custom and practice. As I said at the beginning of my comments, tinkering on the margins of what we've always done is just not good enough. We need to tackle the future with that energy for innovation, that hunger for change that will bring and sustain our healthcare system into the future. So as I speak to you today and in conclusion, I would like to reiterate that the future we believe is bright. There's never been a better opportunity to change. We need to. People understand it. There's not a household in our communities that is not aware of the fiscal challenges and the sustainability of the healthcare system. People are ready for that reform, and it's health authorities and the health system that can work with local communities to secure that vital future.